Welcome back to the Noon Show on WBAY TV2, and welcome to Ask the Expert with Dr. Kurt of Tower Clock Eye Center today. It's great to see you again, Doctor.
Thank you. Same to you.
Tower Clock Eye Center has been serving this community for 3 decades, over 30 years, and you have seen a lot of developments, not only in the eye, but in the treatment of the eye, and in surgical treatment as well. It's really remarkable how far things have come.
It is, and one of our driving goals with doing surgery at Tower Clock Eye Center and Tower Clock Surgery Center is to really make the process as painless and comfortable as we can for the patient.
You only get one set of eyes, and I'm sure that's the big concern.
Correct.
It's psychologically very fearful when someone walks in that door, I'm sure, and you're facing this, the prospect of surgery.
Yep, sometimes yes, sometimes no, but obviously I think what I always tell people is whether patients admit it or not, our assumption is always that everyone's going to be pretty nervous going into cataract surgery. It's kind of an intimate part of our body. You've got somebody right there working on you. But we really do take steps to make sure that people are comfortable and relaxed for the surgery. And one of the things we've adopted recently to really make the process as streamlined as we can and as comfortable as we can is to introduce IV-free or no IV cataract surgery. So it's interesting, as the doctor, I'm always concerned that the patient's worried about their eyes. Oftentimes what makes them more nervous is worrying about having the IV put in before the surgery. So eliminating that has really, I think, really helped patients kind of move through the process more easily.
Does that help with recovery time for the patient? Maybe not necessarily the IV, but certainly your surgical center.
It does. It does. So saying there's no IV doesn't mean there's no sedative. We do still give patients a little sedative before the surgery, if they'd like. Some patients choose not to. But the sedative that we use is an oral solution. It works very quickly, so we can give it to the patient and have them nice and drowsy by the time they're going back to the operating room. Still awake, but more comfortable. When we're done with the surgery, then the medication wears off very quickly too, so we haven't ruined their whole day. And you know, despite that, we do still have patients who request more medication. Maybe they just feel like, okay, this isn't going to work. That's fine. We're happy to give them an IV and do it using other medications. But for most patients, everything works great. They're nice and comfortable. We can talk. We can chat about, you know, movies or their favorite restaurant or whatever, you know, anything but the surgery that we're currently doing, and they're happy with the experience.
And just your surgical center, I'm sure, compared to the setting of a hospital, puts people at ease.
Well, right, exactly. We really do try to tailor the approach to the patient. We really try to do it from a patient-centered perspective. So just little things like allowing the patient to keep their clothes on, allowing them to leave quickly. It works very well.
Little things that make a big difference at Tower Clock Eye Center with Dr. Kurt. If you'd like to get a hold of Dr. Kurt or anyone at Tower Clock Eye Center, it's as easy as following the information right on your screen. It's always available by going to WBAY.com and clicking on Ask the Expert. We'll get you back into the Noon Show right after this.